Just like the development of cancer is a process, the treatment of cancer is also a process. It's not something that you can just go in, get surgery, remove it, and not change anything else about your lifestyle, your mental health, physical health, spiritual health. Something needs to change drastically if you have any chance of the cancer not growing back. My name is Dr. Lori, and I want to go through the top 3 things that you need to know in order to reverse your cancer, to make sure that you're living an anti-cancer life, and to build an environment where a tumor does not want to grow. The first part is a very thorough onboarding phase. This is where we get you to fill out lots of questionnaires and all of the information as far as why did cancer even grow in the first place. Myself and my team will evaluate all this information, looking at your immune system, your digestive system, how you're sleeping, a thorough diet diary, what you're putting in your body now, and even from years ago if you've changed your diet over the years. We also want to know what your bowel movements look like, how much water you're drinking, stress levels, and even going further back from what your mother's health was like even while you're in the womb. So all of this information is extremely important to get to know where the environment that the tumor is growing in. And that's the most important thing, because you can cut out a tumor and just, hope that it doesn't grow back. So also in this onboarding phase is where we're going to look at a thorough blood work, a metabolic panel. So looking at inflammation, how your body's dealing with sugar, looking at cholesterol, fat metabolism. We want to know energy levels, nutrition status. There's a very thorough intake that we need to follow to really understand you. I get asked all the time when people are messaging me saying, hey, my mom has ovarian cancer, or my husband was diagnosed with prostate cancer. What should I do? And if the answer was that simple, I would love to say, just take the supplement. That sounds great. But the real way to answer that is to look at all of the reasons why the cancer is able to grow in the first place. And that can take hours for me and my team to really dissect the nitty-gritty of what's going on with you and your health. So I wish it was a straightforward answer of what your treatment plan would be, but in order to really give you the most effective way to go forward, we need to know the background of why the cancer grew in the first place. So after looking through all of the information, looking at immune system, digestive system, stress levels, getting everything combined and really compacting it into an organized way for you and getting this whole metabolic look at what's going on in your system, then we are able to formulate a treatment plan. And this treatment plan can vary depending on which stage of your cancer journey you're in. So if you've just been diagnosed with cancer, that's a really great time to come see me. If you have started chemotherapy or you're about to start, if you have completed or started radiation, there's so many things that we can do to help protect the healthy cells in your system and make sure that you're as strong as possible throughout this journey. Although there are a lot of things that you cannot do during chemo and radiation, and I'm sure your oncologist has said just avoid everything just in case, the truth is there's so much that can help protect your system and make sure that you're not damaging your immune system and actually aggravating your stem cells even more to make the cancer grow back angrier the next time. And this is a big deal because a lot of people don't realize that conventional treatments are quite toxic and the side effects of them is a secondary cancer. So we want to prepare your system to be as strong as possible and take all of those things into consideration. Now that's on the cancer front, but what about how you're feeling mentally, physically? Do you want to feel like crap the whole time through conventional therapies? Most people do. That's just the reality of these harsh toxic drugs. And there's so many things that we can do to help keep your energy up, prevent the peripheral neuropathies, to help with your sleep, with the anxieties, even the traumas that come up. If you've been diagnosed a second time or a third time, that PTSD that you're feeling is very real. And also I've heard a lot where people have had traumas in the past, whether it was abuse or neglect or rape even, and how that has manifested into having more fears and traumas when they are diagnosed with cancer. So all of these things are really important to look at and to integrate with your treatment plan to help with the anxiety, to help with those fears, and really support you throughout the whole journey. Make sure you download my book, Cancer Doesn't Own You. I talk all about this, where I go through 160 ways that you can build your health and beat cancer daily. If you are interested in working with me and my team, then I encourage you to apply to work with us. It is an opportunity for you to be in more control of your health and the cancering journey or cancering process. It's not just one intake or one assessment and say, okay, there you go, good luck. What we do is we help every single week make sure that you're on track and answering all the questions that come up throughout the way. Because anytime you're introducing something into your own treatment plan, there's going to be things that your body's reacting that may not be predictable. So we want to help you throughout that, no matter where you are in this cancer journey. Just like you think about it, if you were in a really shitty marriage, if you're married to someone that you were fighting with completely for 10 years or longer, and it's just a very toxic relationship, you would not go into therapy just for the 1 hour and say, you know what, we've worked out all of our issues, we're good now, we're gonna be healthy and everything is gonna be just happy-go-lucky. That's usually not how it happens with our health either. So just like cancer takes time to grow, there's things that you may not even been aware of that are stimulating cancer's growth or driving it to grow faster. So just like that 1 hour of an assessment or coming up with a treatment plan is not nearly enough, that is why we want to have multiple times of interacting with you, educating you, and really supporting you throughout this journey. So working with me, there is those 3 steps: the onboarding, the treatment plan, and then the support. So those 3 things are extremely important. You can't have one without the other. The other part of the onboarding phase and kind of transitioning into the treatment plan phase is having access to a worldwide oncology-focused group. This is part of the Dr. Naisha Winters group, where all we talk about is how we can support patients with cancer. There's doctors from all over the world who are oncologists, radiologists, surgeons, and they come from different worlds of medicine that could really give us another perspective on what the next best step should be for you, and understanding, okay, if you did do chemotherapy, how can we support your body better? If you need to do radiation, some people are just pressured into going into the next step when it comes to conventional medicine and saying, this is the algorithm, this is what you need to do, but is it? Do your genetics align with that? Is that something that may be not necessary for you and can actually be more harmful than beneficial? So this is a really exciting part of being part of my team and helping your system with cancer, because you really do have 60 doctors or more looking at your case and helping you with your next step that you should take to make sure that you have the confidence that you're doing the right thing moving forward. If this all sounds exciting to you and you want to have all the tools and resources that you need to fight your cancer in the most effective way, I don't love the word fighting cancer, but to heal your body and strengthen your body in the most effective way. If you have any desire to take control of your health and really help turn the cancer around and feel more empowered with other people going through the exact same journey, I encourage you to apply and to really reach out to my team. I would love to be part of this journey for you, understanding why the cancer is growing, taking on a metabolic approach. If you are doing anything other than a metabolic approach, then you are not getting to the root cause of why the cancer is there in the first place.